together because there's a lot of really good information we're going to be sharing today. So this is Cassandra Furman, and I'd like to welcome you to this quarter's Performance Measurement Learning Collaborative. And you probably received an agenda and a lot of documents that I've sent out. And today we're really lucky that we're going to be hearing from some of the people who created those documents. I'll just review the agenda quickly. Let me let Leanne in. There you go. We're going to start out with a welcome, see all who's here, and introduce ourselves briefly because we have a big agenda. And then we've got a little update from Arch that Jill will be sharing. Then we have three people who've offered to talk about some of their data collection methods and how they're being used. And those are Sarah Taves and Marilyn Sword, and they are with the Idaho Caregiver Alliance. Also, an old friend of Arch and Respite, Mary Jo Almeida Caruso, was going to talk about how she's collected outcome data using a quasi-retrospective measurement tool. And then we're going to learn from Tracy in Alabama about how she has or how they've collected data for the white paper that I sent out earlier. So she can talk about that. And then I want to make sure we have time for lots of Q&A because there's great information to share. And we'll also, hopefully people have challenges that they'd like to bring up. We can problem solve together on different ways of collecting data on your program. And then we'll identify a few topics for the next meeting. So I'm going to move into who's here. So basically, I hope we can all see each other on the screen, but I'd like to hear who all's here. Why don't we start with the West Coast? Just really quickly say hello. I'm in the West Coast, Cassandra Furman with the Arch National Respite Network. Other West Coasters, and someone the other day said, does Arizona count? We'll count you. You can decide. So please just share your name and where you're from, and we'll go to the next.
This is Corey in Las Vegas, Nevada.
Hi, Corey.
This is Marilyn Sword from the Idaho Caregiver Alliance, and we would be on the coast if Oregon and Washington fell off.
And I hope it doesn't, but it's a possibility.
Well, I think I'll follow. I'm Jeannie Delaplane, and I'm with Washington State's Lifespan Respite, and I'm hoping we don't fall off.
Okay, well, we can move to the Midwest, all you Central Time Zone folks.
Sharon Grow, Partners in Caregiving from Illinois.
Hi, Sharon.
Ronelle Baker with Sooner Success Lifespan Respite Program in Oklahoma.
Hi, Ronelle.
I'm Tracy Sinowitz with Alabama Lifespan Respite.
Hi, Tracy. I think we've made it to the East Coast nearly, so.
Anybody from Mountain Time?
Oh, when I was looking more, not time zones, but good one, Lori, thank you. I think we have Idaho's in Mountain Time mainly. But okay, let's go to the East Coast.
Perfect.
Dina Prest here from New York
Joe Ward
State
here
Office
from
for
South
Aging.
Carolina.
We had two people, but I heard Joe Ward, and who was the other one?
Dina Prest,
Hi.
New York. Abby's on too from New York.
Hi, Abby. And Lita, aren't you from Arizona?
Yes. Hi there,
Well,
everyone. Sorry about that. I came
missed
in
a
a little
West
bit later,
Coaster.
but yes, Lita from Arizona on the line.
Okay. And I see some other people on the line who are staying muted, but we have Brandon, I believe that's South Dakota, and Susan Summers. I know you're from Washington, my friend, and Mary Jo Caruso and Jill Kagan, both from the East Coast. So let's just keep going. Welcome everybody. I'm glad you can join us. Now I've got to make this move.
Cassandra,
Yeah.
may I introduce myself?
Oh, I'm sorry, Lori. Yes, please.
No problem. Hi, I'm Lori Stahlbaum. I'm the project officer for the Administration for Community Living, Administration on Aging for the Lifespan Respite Projects. If I were in the office, I'd be in DC, but I'm not, so I'm in Maryland.
Sorry, Lori. Thank you.
Oh, no problem, Cassandra. I had my phone on mute when I tried to talk. I don't know why it didn't work that way.
Yeah, I've just been really conscious of time, so I'm probably pushing forward too quickly. But right now, Jill, would you like to share, or Susan, both of you, a little bit about an update with ARCH?
Susan, do you want to go ahead and talk about the innovative?
Yes, I'd be glad to. Can you hear me?
Yep.
Okay. So the Innovative and Exemplary Practice Respite Service is an initiative by ARCH that we began about 4 years ago. And we review applications from around the country from programs that are providing respite services throughout the lifespan, lots of different models. And we want to do this because we want to recognize the work of those programs, but we also want to develop a database so that providers in your states can go and see what others are doing in terms of best and promising practices. You know, there's not a great evidence base for respite research, but there are some things that we know work, and we look for those things in the program, such as giving, you know, a minimum number of hours per week respite. And then there's things that we know are promising, but they have performance measure data, but maybe don't have refereed journal articles and true experimental design. But we include those too. And as I said, we're building a database. Cassandra and I are going to work on a matrix to make all that information available to you online. But in order to do that, we need to find the programs. So what we'd like you to do at the state level is to keep your eye out for programs and recommend that they apply. Again, we can't build a database and we can't learn from them if we don't find them first. And one of my favorite programs, Share and Grow, recommended that they apply to us. So, you know, if you aren't aware, put the word out in your coalitions and actually become aware of what's in your state if you don't know. And please help us out by sharing the wealth of your expertise in your state with the whole network. And deadline's been extended to April 1st. So if you know of a program, give them a friendly nudge to apply.
Thank you, Susan. I know I put you on the spot there. I just got the email from Jill this morning and I thought, man, I better remind everybody about it. So thank you again. At this point, I'm going to hand it over to Sarah Taves and Marilyn Sword to talk about how they're using the caregiver navigation tool to collect data. So hit it, Sarah, and you're on mute in case you're talking.
Sarah, do you want me to go first and hand it to you?
That would be great, Marilyn.
Well, at our last meeting, I think in October, we were talking a lot about logic models, tools, and other methods of collecting data that would be really useful in evaluation and sustainability. And I was able, fortunately, to connect with Dina Prest because Dina and New York and Idaho are both looking at using the TCare platform. And so she and I have had some conversations, but I want to introduce to you Sarah Taves and Destiny Triplett from the Idaho Caregiver Alliance. Sarah is the director of the Center for the Study of Aging at Boise State, and she is going to do our presentation today. And Destiny was very helpful in putting together the logic model for the Family Caregiver Navigator project that we've been operating over the last 10 months or so. So I'll hand it to you, Sarah, and then Destiny, if you see anything that we need to, that we're missing, you just add in, okay?
Marilyn. I also want to call out that Lynn Fines is on the line. She is with our Idaho Commission on Aging, and she is our partner in the Idaho Caregiver Alliance. Our funding, the funding for the Alliance comes through the Commission, and certainly do want to acknowledge also the Administration on Community Living for your ongoing support. We wouldn't be able to do this work in Idaho without this external, without these external partners. And we believe, we know that measuring performance is a really important part of the case that we are working to make with our legislature, with policymakers, with administrators within the state of Idaho and beyond about the impact of our work. So I'm delighted that there is a collaborative that is thinking about performance measurement. I am an evaluator from long ago. This is one of my passions, is to really work particularly with community-based programs, and how do we tell our story of our successes and also our challenges. As you got in it, you have in advance of this presentation, one of the primary tools we use in guiding our evaluation work is the standard old logic model. You know, this has been out for a while, but it certainly does help, I think, communicate the program in a very succinct way to across audiences. So the mission of the Idaho Caregiver Alliance is to advance the well-being of caregivers through collaborative efforts. And this particular logic model is designed for our Family Caregiver Navigator pilot project. We have 2 years of funding to deliver, to test and pilot the Navigator program. And as Marilyn mentioned, we are using the TCare pilot or platform in this work. So logic model, just really simply, you know, trying to lay out what are the resources we're going to need to do this program, what are the activities we're going to do, what will result from those activities, and in a logic model format, those are often referred to as outputs. And then if we do those outputs, if we deliver these activities, what are we hoping to see in relationship change? How will the participants be different in terms of their knowledge, awareness, and attitudes? How will our partners be different? And then hopefully with that change in awareness, knowledge, and attitudes comes a change in behavior. And that then looks at, you know, actually engaging in supports for caregivers, and then that ultimately leading to systems change. So that's the kind of the theory behind, that's the logic behind a logic model. But to break it into kind of the evaluation components, as we build our evaluation plan, we look really specifically at outputs and the inputs and the resources to build our process evaluation plan. And this is, again, you know, are we delivering what we said we're going to do? And this is key to fidelity. We have an intervention, we have a plan. Are we staying true to that plan? So this is, I think most of us have probably done lots of output evaluation or outcome evaluation, counting number of participants, satisfaction surveys, that type of activity. We also try to develop SMART objectives, so objectives that are going to be measurable and time specific. So I've given a couple of examples of those, and I'll certainly share these slides with everyone after this presentation as well. But again, you know, I think one of the theories here around evaluation that I strongly believe in is it's got to be simple. It has got to be simple, because we're all busy delivering. We don't really, I mean, evaluation is important, but what we care about, what we're passionate about, is reaching the needs of the public, of really getting out there and working with our target populations. So evaluation has got to be simple and straightforward in my perspective and from my experience. Let's see here. So moving on to outcome evaluations, this is where I think the rubber meets the road. Are people different because of what we've been up to? Are systems different? And typically in short term, and many of our programs, we really are limited to focusing on short-term outcomes, because often intermediate and long-term take much longer than many of our projects allow us to engage in. But these are much tougher to measure. You know, we're looking at this change in awareness, knowledge, and attitudes among caregivers. Wow. man, we can have the stories, which are super, super important, that qualitative story. But I think we also have to marry that with some numbers, with some quantitative data. And these are tough concepts to kind of get a handle on. What does that tangibly look like, that change in awareness, knowledge, and attitudes? What we're looking for in this project is, we know that we have many members of our community that don't have a perspective on the value of a family caregiver. So we're looking at, can we change the minds of healthcare professionals, gatekeepers, agencies, and policymakers in this world, in this work that we're doing. So an example of a SMART objective for one of our short-term outcomes is caregiver confidence in their ability to manage stress will increase by 50%. 3 months after completion of a care plan. So that SMART objective, specific, time limited, and also realistic in terms of setting a goal for the program. The method that we use a lot in community-based evaluation, and this is really popular among 4-H programs, educational settings, is this notion of a retrospective pretest. And I think Cassandra sent out a copy of the retrospective pretest that we're using in this model. But the heart of it is that you ask a series of questions about now, after you've had the chance to speak with a family caregiver, how confident are you in your ability to identify actions that you could take to reduce stress? And then also in that very same survey, you're asking, before you had the opportunity, what's your level of confidence? So in a one-shot survey tool, you are gathering both pre and post without having to have identifying information. I mean, I don't have to code this survey to make sure I get the pre matched up with the individual's post. I don't have to get their name. It just is a very simplified strategy of capturing these relatively intangible notions of change in awareness, knowledge, and confidence or attitudes about specific things. So this is a strategy that we've been using it with the Lifespan Navigator program that we're showing some promise of being able to create and capture some quantitative data to go along with the stories that we've heard. And so you get this data, you got to do something with it. This is a report model. This is the report that you're seeing on the screen. This is from, I apologize for not having looked up the name of the individual that we captured this from, but this is based on the model of, you don't want your evaluation reports to get dusty on a shelf. You want them to be short and succinct so people are actually going to read the darn things. And I'm going to pull this up to get a little larger picture of this. I think this is going to work. Let's see. That's the PowerPoint. Here we go. All right. So I think, are you seeing that in a slightly larger version now? Oh, great. All right. So this is the evaluation report from our first 3 months of our Family Caregiver Navigator program. Very succinct. What we're doing, what are we interested in, how we did it, what was the survey methodology. Now, I come out of academia, so I love writing a long method section. Nobody cares. Well, very few people really care about that. Get it to 2 sentences and you can get your message across. How we did it. So we did a survey. It was, we sent a follow-up reminder, and then what we found. Again, succinct, really clear, simple, is what you want to be able to share with your stakeholders. And so what we found in the first 6 months of the project, 47 caregivers have completed the care plan. 18 of these individuals responded, had a response rate of 38%, average age, a little bit about the demographics. But I think what our stakeholders are really wanting to know, and what we want to know, is this making a difference in the life of the caregiver. And what we're looking at here is our pre-post using a retrospective survey design in their confidence in ability to reduce stress, access resources, make positive change, communicate needs, use telehealth, continue to care for the individual in their home versus having to place them in an institution. So again, trying to create a clear and succinct story for our target audience who we know are likely not academic researchers that love to read a full-on report, short, sweet, simple, and it gets the message across in a way that's based on it's based on evidence. This is not a made-up foo-foo model of evaluation using a retrospective pretest. So this is an example from our Family Caregiver Navigator. I also wanted to share, and I think you're seeing my PowerPoint again. Is that right? You're seeing, okay, perfect. So another example from the work that we've been doing in evaluation is looking at the impact of the consumer-directed respite program in Idaho that's been piloted in one area agency on aging region. And this is the results of using a retrospective pretest again. And so we had 21 participants in the program, and this is the consumer directed respite program. And we were looking specifically at the short-term outcomes of their perceived ability to pay for, find, cope with stress, care for their loved one at home, address other challenges associated with caregiving. You know, if you want to throw in a couple of statistical finding, words, you can do analysis on this. We did do some statistical analysis on the change between pre and post. So you can create a p-value with a retrospective pretest design. I mean, you can get into the statistics, but you don't have to either. Really, I think this visual is pretty compelling about what we're looking at in terms of before their ability to pay for respite was at a 2, and now it's at a 5. So some fairly visual evidence of, seems like this consumer-directed respite must really be assisting caregivers in finding access and using respite. And then finally, my last slide is just a bit of a very, very short bibliography on some of the research behind the retrospective pretest design, because we certainly want to support our methods and know that they're based on sound science. This design is not perfect, but it does allow a very simple, easy way of capturing pre and post at a one-shot design. So that's what I have to share. I hope I tried really hard to stay in my 15 minutes. I love talking about evaluation and be happy to field questions now. Or Cassandra, if you'd like to wait till the end, I'm happy to do that as well.
Why don't we take a few minutes and see if there are any initial questions, and we can have more of a discussion later. You did a lot in 15 minutes. That was great. Thank you. I'm going to open the floor. Does anyone have any questions while we've got Sarah and Marilyn with us? Just feel free to speak up.
I think one observation, I like the information. Thank you, Sarah, for sharing that. But I'm always impressed with the fact that the numbers don't have to be exceptionally large and still have value in what's being communicated.
Mm-hmm. Yeah, that's a great point. As you've noticed, our N's are relatively small at this point. An N of 17 or 18 for our Family Caregiver Navigator. On the consumer directed respite, an N of 21. Those are relatively small, but we're telling a story, and the pattern is really significant. This isn't just a one-off of a change. It's 21 people that really are representing this level of change. So good point, though, about that challenge of some people will push back and say, well, you need to have at least 30 to have anything that's valid. Well, whatever. We move on,
Sarah, I have a question, and forgive me if you already mentioned this. Was your sample specific to a region or a county, or was it the entire state?
So both of these projects that I've shared here, they are regional and they're both they're results of pilots. So they are located both in southwestern Idaho. Again, we are trying to produce the evidence here for things to go statewide.
Did you compare, so I'm not really great about my Idaho geography. So was this all rural or were there any urban environments?
Great question. For the consumer respite results, those were really focused on rural residents. Within the Family Navigator program, we are capturing their zip code so we know where they're coming from. With an N of 17, we don't have enough participants yet to kind of parse out, you know, is it the same across all geographic regions, but that certainly is our goal. And as Lynn just chimed in on the lifespan respite piece, that data is just a snapshot from 6 months of folks involved in the program. From the Family Caregiver Navigator data, that's we launched that about 6 months ago as well. Yeah.
Fascinating. Thank you so much.
Yeah, you're welcome. Great questions.
This is Lori. I have a neophyte question. On the consumer directed slide, where the lines went from this big to all of them this big, that was super cool. In your statistics, you had P less than 0.001. And since it's been over 35 years since I took my statistics classes, could you please tell me?
Yeah.
I think
Great
I know
question.
what it means, but I'd rather have the academic expert, research expert explain it to me than me try to guess.
So what that is saying, Lori, is the pattern of change was so strong from pre to post that there's less than 100 chances that that's due to error. There's it's a minuscule chance that what we're seeing in that level of change is just due to chance. It's a true pattern of change from pre to post there.
Well, that graph gave me goosebumps. I tell you, that was like, whoa. Excellent. Sorry, I get excited. I might.
Well, and that's exactly what we're hoping these very simple visuals will do for stakeholders, because that's the audience we have got to reach. You know, it's right. I'm glad to hear the goosebumps.
Thanks. And you know, we'll have time.
Hi, Sarah. I have a quick question. Oh, I'm sorry.
No, go ahead, Lita. One more question, and then we'll keep moving, and you can all ask questions after everyone's gone. So, Lita, go ahead.
Okay, I just wanted to know, Sarah, in your sample, had any of the family caregivers participated in respite care before the pilot program, or was this their first, experience with respite?
That's a great question. From my knowledge, and Lynn may want to chime in here, I think there was a mix. I think many of these caregivers in the consumer directed respite program, though, the Area Agency on Aging really focused on getting this program out to individuals in rural communities where there are no respite providers. They needed to rely on a neighbor, maybe a grandchild, someone to provide that respite. So I think the majority, from what my understanding is, they were new to the respite enterprise. I probably had heard about it, but had never been able to use it because there's nobody in, the town of 50 that actually has that, capacity to provide respite formally. So.
Thank you. Thank you, Sarah. And again, everyone, we can ask more questions later. But right now, I'm going to take over screen sharing just for 1 second, because I'll hand it over to Mary Jo Almina Caruso. For those of you who weren't here during the introductions, Mary Jo has been involved in respite for as long as she probably remembers, and certainly as long as I remember, because I'm getting older and my memory is getting shorter, but she is one of my respite heroes. So Mary Jo, take it away.
Thanks, Cassandra. And I'll just kick it off by saying I sat in 2 different seats and wore 2 different hats during my respite work. One is with our statewide lifespan respite program and grant, I served as the head of Pennsylvania's Lifespan Respite Coalition. And concurrently, I also coordinated a respite program that provided direct services. So part of my work was to look at how to inform and get a picture of what our statewide respite effort was doing, but also then to look at how to help local programs, including my own, measure some of the impact so that we could demonstrate to our state agencies, to our funders, and to others the benefit of receiving respite. And while we had collected up to that point a lot of anecdotal information, we didn't have a lot of information that really spoke to the impact of our efforts. So I am going to share my screen. Let me just start from here. So we really started with a conversation about what kind of data we needed to collect, you know, in terms of individual providers, that demographic piece of, you know, how many people are showing up and who are they? And then services, you know, what are we funding and offering to participants and how often, some of that frequency and dose information. We also wanted to look at fidelity, which is, you know, from the state perspective, was our approach or models, you know, what were they and how can we ensure that we're funding services that are intended? And for us service providers, how could we ensure that we were providing services as intended? And then obviously some cost analysis. We wanted to ensure that there was either a cost benefit or return on investment. And then of course the outcome impact data around quantitative and qualitative. And I will say overall, we were great at the qualitative information. We had collected a lot of stories about change, but we really didn't have some of that other impact information to help. So, you know, when we did our statewide effort, we worked with our University Center for Excellence that really helped us pull together some information. But when I worked from the local program level, I worked with Ray Kirk, whom most of you know, and we looked at what the logic model for the Care Break program, that was my respite program, was, and really tried to look at what was the impact of those services, and was Care Break responsible? What could we take credit for and what could we not take credit for? So we moved beyond some of the fidelity measures and satisfaction, and not to say that we didn't do those things, but we knew that that wasn't giving us enough. And what we actually wanted to do is take a bunch of different evaluation strategies and triangulate all that data. So it was important for us to know, you know, how many people were showing up and what was the typical profile. It was important for us to know that people were satisfied, but we also wanted to ensure that what we were doing was making an impact. So that was really more around tracking participant changes. And I believe Cassandra has shared with you some of the, excuse me, actual tools that we used. And again, these tools were specific to the program that I was implementing at the time. They may not be specific to your program, but you are free to take these, look at these, adapt these, you know, and use them however you see fit. And I know that I'm going to talk a little bit more about the retrospective element, but I did want to talk with you about, before we did the retrospective, we did a traditional pre-post, which involved a lot of matching for us, the pre-survey and the post-survey, ensuring that confidentiality was kept. But the reason I want to talk about the pre-survey is we implemented it at a very key point. We wanted to know, for example, how people's stress levels were before receiving their service, but found that if we asked the families during the time of intake, when they were sort of waiting for a provider, and that wait, because we used very carefully screened and trained volunteers from their own community, that wait could have been anywhere from 2 weeks to 2 months to longer. And so there was a prospective concern that sometimes families would indicate their perceived stress was higher then it may have been in order to hopefully bump them up on the wait list. And actually, and that was really not how our wait list was based. It was based more on the availability of the provider. But knowing that was really important for us, that we knew how our program worked, but the family's perception might be different. So what we did is, rather than do a pre-survey during the time of intake and when people were walking in the door and we didn't have a relationship with them, we didn't have that trust built, we did the pre-survey at the time when we identified the respite provider and we were bringing that provider to the family's home for that initial meeting. So there had been no respite caregiving taking place by our program prior to that time. So we could be sure that they hadn't received any services yet from us. But we also knew that we were alleviating that potential risk of having families overinflate or not be accurate with their perception of their stress, because they could answer it honestly and know that their provider was right there, prepared to provide care immediately after we began, the actual matching process. So we wanted to know some things like, how stressed were families feeling? What did they anticipate doing with that time? Because we wanted to ensure that families' time was meaningful. If they didn't know what they were going to be doing with that respite time, we wanted to spend some time helping them think about that, because some of the feedback we got from families is really related to, oh my gosh, I sat down at the computer when my respite provider came with the intent of, I don't know, shopping for shoes. And the next thing I knew, I was paying bills and filling out forms and the time was gone. And so we wanted to provide families with some thoughtful time to indicate how they were going to use their respite. We did want to know if there were other things that they were, other services that they were receiving. We also wanted to know things like, what's happening in your life right now? What are all the stressors that you may be experiencing? And those stressors can be good stressors like planning a wedding. They could be other types of stressors like lost my job, stuck in the house due to COVID. We wanted to gather that information because it was important for us to understand what parents and family caregivers were experiencing at the time of entering our service. And then we did a post survey. And we did that after the anticipated frequency and dose of our services was delivered. And for us, that was around the 6-month point. We did that in the form of an interview, which was incredibly scripted and very specific, because we wanted to be really clear what this was. This was not a time, if you had a concern about your respite provider or things like that, we wanted to ensure that there were opportunities all along to do that, that this was really a time for them to confidentially share the impact of their services. So we did that for a while, and we looked at that data and looked at what we could take credit for and what we couldn't take credit for. As an example, if you're a respite worker, you weren't getting the right frequency and dose, you may not have a lot to share. So we wanted to ensure that families were getting what they were saying that they needed and what the program could provide. And we were matching that with what was happening in their life. So let's say you were getting the appropriate frequency and dose, and you said, my life is great. And it might be an assumption to say, well, your life is great, your stress is less, and you're making better decisions regarding the care of your child because you're getting the appropriate frequency and dose of respite. But then we found out that they just won the lottery and now they're multimillionaires. And, so probably that 4 hours of volunteer care they were getting per week was not responsible for this overwhelming feeling of euphoria and control in their decision-making that they were having. On the other hand, let's say they were getting the appropriate frequency and dose, and they said, my stress level is off the charts. This isn't going well, whatever. And through the using the checklist of events happening in their life, we come to find that, oh my goodness, they lost 2 family members. They got their hours cut back at work. They're at risk of losing their housing. Their child's educational needs are not being met. Well, you know what? That 4 hours of volunteer respite every week, although helpful, was probably not as meaningful at that time. They weren't, you know, it wasn't completely relieving the stress in the way that we had all hoped. So there was a reason that we tried to collect some of that information so that we could take credit for what we did and what was helpful, and we could ensure that we weren't taking credit for changes that we didn't have any control over. So we started to do a retrospective tool then, because we were hearing from me, the program director, and my graduate students that were doing this, that it was getting really difficult to do these pre-posts as we were going along. And again, we actually did the pre-post and the retrospectives at the same time, and had Ray Kirk sit down with us and say, was there a significant difference between what we're seeing in the pre-post versus the retrospective? And what we found was there wasn't a statistically significant difference. So we could move forward and use the retrospective tool and really rely on the fact that the families, their awareness of their experience was pretty darn accurate. So we had a very specific time frame that we applied this retrospective tool, but knowing that our minimum frequency and dose of services that we ask our caregivers and our family members to commit to was 6 months. So what if a family stayed in for 2, maybe 3 years? We had families involved in our program with the same caregiver, respite provider, for 5 or more years. In that case, we weren't using the retrospective over and over again. We used the retrospective initially for our baseline. And then if we wanted to evaluate down the road at 4 to 6 month intervals or yearly intervals, we used our post survey in order to capture if there were some changes along the way. So with that in mind, that's how we implemented to show some impact of our services and to try and determine things like, you know, what was the length of time families were receiving services. We asked how long they were on our waiting list. We tried to look at how stressed they were as a result of caring for their family member. Were they able to do the activities that they had thought they wanted to do prior to coming into services? And maybe not, you know, maybe they found out that a nap was more beneficial than getting bills paid. Maybe they found that going to their other family members' events was more meaningful than, you know, whatever. We didn't want to judge that. So we didn't ask them to indicate things any more than, are you doing what you intended? And if not, are those activities meaningful to you? You know, so for us, I think we really wanted to focus on meaningful use of time, reduction of stress, and then using that with some information that we were able to show some data that shows that when people are not stressed and they have time to make decisions, they tend to make better decisions for their family member or with their family member who might have significant disabilities and healthcare needs. Could we take that information and necessarily and say 4 hours per week, you know, ended up in folks not institutionalizing their child? No, we couldn't. What we could say though is we were hoping that providing that care, showing the reduced stress, showing the increase in meaningful use of time, that families were making better decisions regarding their child's care, whether it was to maintain their child in the home, or as their child transitioned into adulthood, they were looking at some options that maybe they weren't able to explore when they were under significant stress. So I will just pause there because I think I've used my 15 minutes of fame as well. And I will turn it back over to Cassandra.
Thank you, Mary Jo. So questions, please. I'd like to hear, I know Mary Jo's good at answering questions and She's good at presenting. So does anyone have anything to ask Mary Jo? And you'll have time again afterwards, the whole.
And I did see the note in the chat box. Yes, working with our University Center for Excellence for People with Developmental Disabilities. Every state has one. And they are a great place to help you capture statewide information because that's their job. Their job is to have that statewide reach. They're great at not only helping to find tools for you that may match what you're trying to measure based on your logic model or other things, but they're also great at helping you to develop tools, maybe that are more program specific. And students love to play with that data and look at that data. That's a very credible and rewarding time for them. So we were able to benefit from the University of Center for Excellence in Pennsylvania, which is Temple University, and they in turn helped to reach out to local universities such as the University of Pittsburgh and Clarion to work with local programs to develop some of those tools to gather some of that information. And our University Center for Excellence actually acted as the conduit for all of that data, aggregating it so they could also help us provide a statewide picture while local programs were able to get the snapshot of their impact as well.
Thank you. I completely forgot about the chat box. I should have been monitoring. Are there any other questions for Mary Jo? And feel free to put them in chat now that I've got my chat box open, or you can just unmute yourself.
And I would just add, feel free to take those tools and play with them. I mean, they were effective for us at the time that they were developed. They may not be effective for you, but they may be just a good, if not a template, an example for you to use while helping some of the local programs gather their impact data while you're looking at the bigger state picture.
Thanks. And I think Lori unmuted herself. Lori, did you have a question?
Oh, I don't have a question. I was just so excited to hear you talk about the USEDS because those are all actually funded by the Administration for Community Living in all the states and territories. So I'm just having so much fun on this call, despite the man having to let the man in to fix my heater while I freeze. But I have met with some of the USEDS, and it's great to hear how they helped you as a resource and what a resource they can be to others, and that they do exist, because I don't know that I don't know how many people are aware of their existence. And I believe they have a resource center. I don't know what the acronym stands for, but I know the organization's acronym is AUCD. Association of University Centers of something. I don't know. I'm making that up. But they're just wonderful to hear that. Thank you, Mary Jo. That was really helpful.
Thank you.
Thank you. Well, I think we can go on, and Tracy, and thank you again, Mary Jo. Tracy is going to, from Alabama, is going to talk about how she collected data for the statewide family caregiving survey. And I've sent out a link or maybe even the actual paper to everyone. So Tracy, if you would take it over. I know you're out there somewhere.
Yeah, I'm here.
There you are. Okay. I have to search my screen.
Yeah. Well, first I have to say I panicked a little bit when Cassandra asked me to talk about this today, because we by no means, we being Alabama Lifespan Respite, were the only ones working on this white paper and collecting data and gathering resources to update the white paper. We're just a small part of the team. And but I kind of know how the process works, so I'll be glad to share what I do know. First, I want to tell you a little bit about how we work, so it kind of makes sense. Like I said, we're just part of the team. So the Alabama Department of Senior Services is actually the Lifespan Respite grantee for the state. We as Alabama Lifespan Respite, we're program of United Cerebral Palsy of Huntsville. We are the grantee subcontractor. And in 2015, ADSS and Alabama Lifespan Respite worked in conjunction with Alabama AARP to gain passage of a Senate resolution to establish the Alabama Lifespan Respite Coalition. And the purpose of that coalition is for partners to work together to address the daily caregiver challenges of caregivers here in Alabama while providing services and supports to those caregivers. And it's also the biggest thing that the coalition is tasked with is advising the Alabama legislature on the challenges of caregiving. And so the first task that the coalition was given in 2015 was to take all of the research and statistics that they already had at their disposal and to create a white paper. And it was called A Voice That Matters, the Impact of Family Caregiving in Alabama. It was completed in 2017, and it was distributed by ADSS and the Alabama Lifespan Respite Coalition to the legislature. And the hope was that this would increase the exposure of public policymakers to the valuable contributions of caregivers and propose actionable solutions. So to build upon that momentum of the first white paper, we updated the white paper this time and are currently distributing it again to our legislators. They're in session right now. And we had three main goals in doing this update. One was to provide an update on the status of the first white paper, those action items that we said we wanted to accomplish, you know, as the Alabama Lifespan Respite and as the coalition. You know, where are we on that? Two, to provide a current state of the state regarding respite and support services for family caregivers. And three, to educate lawmakers on where Alabama is headed in terms of care provider workforce shortages and the increased demand for those services over the next 5 years. So those were our three main goals. The Alabama Lifespan Respite Coalition is really who gathered all of the data to support this white paper. So let me tell you a bit about who is on this coalition. All these positions are governor appointed. It is voluntary. You can say no to the governor if you want to, but each state department that works directly with caregivers in any capacity has a seat on the coalition. So some of those are the Governor's Office on Disability, all of our ADRCs, the Alabama Department of Medicaid, Department of Rehab Services, Department of Human Resources, Adult Protective Services, Children's Rehab Services, Public Health, the Department of Child Abuse and Neglect Prevention, the Alabama Council on Developmental Disabilities, AARP Alabama, Alabama Head Injury Foundation, the Autism Society of Alabama, and then we also have university partners, community and faith-based respite providers, home health and hospice providers, and family caregivers. So we have a broad representation of agencies and individuals who work directly with caregivers or, you know, or caregivers themselves. So we turn to them for data collection. So as Alabama Lifespan Respite, we did create two, in conjunction with ADSS, two caregiver surveys. And one was called Respite Services for Family Caregivers, and it was a survey of caregivers. And the other was a survey of agencies who provide services for caregivers. So the way that we distributed those was through all of those partners that I mentioned who are on the coalition. They distributed those through the agencies that they work with, the care provider agencies, and with the caregivers that they serve. So we had a very broad statewide reach to get feedback and to get people to participate in these surveys. So by no means the survey participants were not just caregivers that we serve here at Alabama Lifespan Respite through education and respite reimbursement. These were caregivers all across the state, represented from all 67 counties in rural and urban areas. So we have a really good snapshot, we felt like, of not only caregivers, but care providers. And the survey took about, you know, we said it takes about 20 minutes, which is daunting for a caregiver who doesn't have a lot of time to spare anyway. So we were pleasantly pleased and surprised that we had over 1,200 caregivers participate in the survey from, like I said, again, statewide, and all 67 counties were represented. And so we used that information from our survey, from Alabama Loss and Respite Survey. ADSS had a separate caregiver survey that they distributed through their ADRCs. They needed a little bit different information for their 4-year state plan. So they had that survey. We used it for the white paper too, the results from it from the white paper. We also used caregiver impact statements and information that was gathered just in community settings through town halls when those were still a thing. We actually went in person and did town hall type situations. AARP Alabama hosted those and ADSS hosted those. When the pandemic hit, they still had several planned and they just converted those over to virtual town halls and had great success gathering some more information through those efforts. So in addition to all that survey data from our surveys, from ADSS's surveys, from AARP's caregiver survey, and those town halls and caregiver impact statements, in addition to that, we asked all of those coalition partners to give us access to data that they had already compiled in their annual reports as it related to caregivers. So all of them offered up that information, and the ones that we utilized the most were from early intervention and the Alabama Department of Education, Department of Mental Health, Alabama Medicaid, and Children's Hospital. Those entities seem to have the largest amount of data and statistics as related to caregivers that they had gathered independently. So they graciously allowed us to use that information in our white paper as well. And I mentioned the ADSS 4-year state plan. It was just released a few weeks ago, and it's over 100 pages, but it is an amazing document, and I'll be glad to share the link to that as well if anyone's interested. It's got an abundance of information in there, mainly about aging caregivers, but about caregivers. So that's a great document as well that was utilized the information that we used in the white paper. What else? Let me see. So the big thing to come from the white paper, from all of this data gathering and collaboration of all of these agencies who are on the coalition to, make the white paper a great document that is gives a lot of guidance to our legislators. If you look through there, starts on page 21 and ends on page 22, we make new recommendations for state policymakers to consider in supporting family caregivers. So one of those recommendations is to build a robust data collection infrastructure to produce new research, analyze family caregivers' needs, and direct care workforce on the state and local levels, determine the number of individuals with long-term chronic mental, physical health diagnoses, such as dementia-related diagnoses, and the number of family caregivers. This would assist policymakers with future planning and advocacy efforts for the provision of adequate services and supports. So basically what we're saying is it took a lot of time and effort to gather all this data to come together. We would like to see one uniform survey that all of these agencies use to gather the data that we need to represent family caregivers in Alabama. So we're hoping that that's something that our legislators will take into consideration and help us make a reality. So that's a little bit.
Thank you, Tracy. What a massive undertaking. I have a question, but I'm going to see if other people have questions directly to Tracy right now.
Sandra, this is Marilyn. I'd like to ask Tracy, this coalition or council, was it created in statute? If the governor appoints the members, I'm assuming it was.
It was a Senate resolution that was passed in 2015 to create this, yes.
Other questions for Tracy? Well, I'm just
a little more about the coalition, just Cassandra. So we as Alabama Loss and Respite, we are the supporting entity to the coalition. So we arrange their meetings. for the coalition as a whole, subcommittees that meet, and we keep the minutes. We share information, about caregivers and kind of keep them up to date on what's going on in respite world. And anytime they share anything with us, we push it out to the coalition. So it's a beautiful partnership. And like I said, it is governor appointed. And but everyone who participates is an active participant. We've had a really good success engaging our coalition members. They're all very passionate about caregiving and improving caregiving in Alabama. So it's been a great group to work with.
Wonderful.
Tracy,
go on.
I'm sorry, Tracy, this is Kathy Mayfield Smith in South Carolina. And I was going to ask a question too about that coalition. Did that grow out of the lifespan respite efforts? And was it,
Yes.
I mean, it sounds like a great vehicle in order to really coordinate things. I mean, in South Carolina, I think we've done a great job coordinating across respite programs, but there's not a lot of leverage. And so having a body that is appointed in statute that can leverage over these state agencies, I mean, that really is the only way you'll get a common data collection tool done, is with that kind of leverage. So this call is probably not the best place to talk about it, but I would love to follow up with you on how you all were able to do that, in being able to get interest in that and actually get that resolution.
Yeah, absolutely.
Is there a time limit to the resolution, or is it an ongoing? Okay.
It's ongoing. The positions are on 3-year terms. So the governor reappoints every 3 years unless someone rolls off, for some reason like retirement, or there are legislators appointed to the coalition too. I didn't talk about them, but we do have legislators who are on the commission as well. And they're very helpful. It's great to have them as part of the team. They give us a lot of insight into what's going on that we may not know about that's not in the news yet. And as far as caregiving and as far as where funding's going and things like that. So they are great partners to have on that coalition as well.
Yeah, as part of our lifespan grants, we've had a state committee on respite the whole time, and we've developed state plans that we've also shared with the legislature, but there's no real power there. I mean, it really is just a plan that's given. So I'm really interested in this and how it can lead to better data collection and a better understanding of the issues, as well as outreach to the legislative body to actually make a difference in what they do. So this was very, very good to hear.
I think it would be absolutely wonderful, not only statewide, to have at least a few data elements that everyone is collecting who's providing respite.
Absolutely.
And of course, my dream would be that nationally there would be, just a few data elements that everyone agrees these are really important for respite providers. This is what we should be collecting. I think that would be nice. I'm actually meeting with the crisis nursery community, a small group tomorrow, because they would like national data across all crisis nursery programs, finding a common element that everyone is providing, and maybe one or two common outcomes for that element. I mean, we're making it as simple as we can. Thank you, Sarah, for bringing that up. But we would love to find something so we can establish some sort of credible starting point for, yes, this does make a difference. This is money well spent. My question for Tracy, when you were talking about people sharing their data with you, how did they submit it? I mean, did they send you an Excel spreadsheet? Did they send you data that had already been tabulated and organized? How did that happen?
A little bit of both. Like I mentioned, those subcommittees. The subcommittees would come together, and Tracy Dunklin with ADSS was, she was really the point person for this project, and so she would meet with those subcommittees And, maybe she, because it is an entire state plan, she works with the Department of Senior Services. She didn't have access to or good data representing the under 55 caregivers. So she would work with a group specifically for under 55 or those with IDD or, these specific subcommittees. And then, whatever they had, if they already had it compiled, like I said, in an annual report, they would share that with her. Or if they had raw data and they would just ask her, are you willing to take this? Are you willing to take this on? And she would take it. And at ADSS, they do have an in-house independent evaluator who evaluated all of our surveys and then helped Tracy compile that. We said Tracy with I and Tracy with Y, Tracy with an I. She helped her compile all of that data to be able to put it in readable format for this for the SWOT paper update.
Thank you.
Mm-hmm.
Are there any other questions for Tracy? And we can actually open this up to the, okay, there's a question. Ronelle, I see you. Or you're just showing your face. Thanks.
I'm just showing my face. That was very interesting. I just want to say that was very interesting. So
yeah,
good stuff to hear. Yes.
And I hope you feel comfortable contacting each other after these calls. I know that Idaho and New York have been talking, and if you, I hope that we're all a friendly enough group that if we phone one another or email each other, if you have a specific question that you want to take out of this forum, that you should feel free to do that. So what I'm going to do, I don't know if I'm sharing, I guess I am sharing my screen. I just wanted to open this up. If anyone in the Learning Collaborative wants to talk about any updates and your data collection or any successes you want to share, or even challenges. So if anyone has a challenge they'd like to put on the table, you've got, obviously, we've demonstrated that we have a lot of experts in the room, and you may even be an expert, even though you may not think you are, many people, here's a chance to put something on the table and we can brainstorm and troubleshoot with you.
Hi, Cassandra. This is Lee Winchester. Yeah, I have a topic I'd like to bring up. So we've recently began working or talking with one of the state universities that has a respite program. And this is something that they put together based on demand. And I would like to expand on this as far as creating a measurable toolkit that we could share with other colleges, community colleges and universities across Massachusetts, as far as using their student population as respite providers. And so I don't know if anybody on the call has experience with that or has done something similar that they could share, and if they have any results on, the effectiveness and or the toolkits that they might have created, that'd be, I just wanted to bring that up. I don't know if anybody has anything to share or comment.
I don't have direct experience with that, but Mary Jo, didn't you recruit through universities? And I'm not even sure if Mary Jo's still with us, but.
No, I'm with you.
Oh yeah, did you recruit
recruiting respite providers or for the evaluation component of the respite?
So I wanted to develop a measure to be able to use, like for the universities to be able to use, or let me think about this. So we're working with one university right now. They have been doing this for a couple of years, but haven't really gone about to measure the effectiveness of it. It's just something that they received a small grant to develop, and so they did. So I wanted to create some sort of a measurable tool and go in there and try to formalize it a little bit, and then create a toolkit to try to expand it across the state. And so, before I even started going out to do that, I didn't know if somebody already had something like that. And so as I was just watching Tracy's presentation with all of the surveys and things, I was thinking that might be useful because we could definitely talk with the families, but I'd also like to get some input from the faculty and the students as well. So I just kind of wanted to expand it a little bit more. Does that make sense?
Yes. So yes, we had obviously the family tool to measure changes in the family caregiver, but we also measured some different things regarding the actual, and most of my folks were college students as well, to measure some things related to the students' experience, as well as working with the universities. And that's probably where our fidelity tool came out as well. And so each of the universities did their own thing, their own nuance. Some of our universities were faith-based, some of them were state-based. But our fidelity tool gave us the opportunity to go in and have conversations with them around some identified core components that were tied to the outcomes. And then the universities could share back with us how they implemented those core components. And I'll give an example. One might be person first language, right? How to ensure that the respite is provided in a way that is respectful to the family and respectful overall of individuals with disabilities. Some universities opted to do some training and use, some person first materials by Kathy Snow, who some of you may be familiar with. Some of our universities asked for family caregivers to come in and talk about that topic. So hearing firsthand from somebody with lived experience. And some of our faith-based universities really took a more biblical way of addressing it and used some different Bible passages and things like that.
Okay.
It did not matter to us how they engaged that level, that core component, as long as they covered it. So that's why some of the fidelity measures were really helpful to us, because it allowed the different components to be identified while allowing each individual university to identify the activities in which would help them best meet those components. So we did, again, fidelity, and we did some evaluation of participants from the student, the respite provider end.
That's very helpful. Thank you very much. I'll reach out to you separately after this, but thank you.
Be fine.
Yeah, great.
Anyone else want to share about their work with universities? I know that we've got a university researcher on the line right now. So
Cassandra,
I don't know if you have anything to add. Susan.
Can you hear me?
Yeah.
Okay, Leanne, I don't know if this is helpful or not, but Rhode Island has, every one of their 5 universities has a nursing program that trains their nurses in respite models. And I know they do evaluation, and it may not map on perfectly, but you might want to have a conversation with them about how they collect data and what they collect data on. Might be fruitful for you.
Yeah, they're very close. So yeah, I mean, that would be great. Thank you. Appreciate
it.
Yeah.
And I completely forgot, Susan, you were not only a professor at the University of Washington, but you, I believe you were with the university affiliated program as well. I don't remember, but.
I was associate director of that, and I was on the governor's planning council. I think that was mentioned. So yeah, in a former life, I'm a huge, huge fan.
So Susan is another resource, Leanne, and she's with Arch and easy to track down. I always know where she is.
Especially during COVID. I'm not going.
During the pandemic, we always know where everybody is.
Yeah.
At home. Okay. Thank you, Leanne. Do you have anything else you'd like to add to that, or I want to throw it open, make sure anyone has a chance to bring up challenges or questions. That might lead us into the next part, since there's all this silence. I want to make sure we have topics for our next meeting. Leanne has already let me know that she'd be willing at a future meeting to talk about how you measure collaboration. So when I send out an invitation to a doodle poll to find a date, Leanne, I'm going to pay close attention to the dates you can participate because we want to make sure we have a chance to hear from you about how you measure collaboration.
Oh, yeah, I'd be happy to share that. Thank you.
Okay. And I'm wondering if it's easier for people to put in the chat box, just type out, or you may speak out as well. What are topics that you would like to pursue? One topic that immediately came up because of what Leanne asked is perhaps how to access university or research institutions, other research institutions regarding data collection. So maybe something on that. But please put in the chat box or unmute yourself. What do you want to use our next meeting for? What kind of topics would be useful for you? I hope a lot of people are writing. Joe agrees with my suggestion. And Joe, I'm hoping, that could be about the university affiliations. And I have a second to that one. Tools for measuring more abstract concepts like collaboration. And Leanne will certainly help us with that, but any other tools. And by the way, I reach out to people when I know that they have something of interest to share, but I don't know what everyone is doing. So if anyone wants to raise their hand and just please reach out to me if you would like to share at our next meeting. And if you haven't written in your comments, because it's we've got 10 minutes left, but both collaborative measurement and the university information are interesting. Okay, good. I'm also planning, Marilyn had asked some time ago, she wanted to talk about measuring outputs versus measuring outcomes. And I do have a little presentation, a mini presentation I could do on that, but that might be a good topic. How do we count those things? I was thinking what counts and what matters, but that would be a topic.
That would be great, Cassandra. And I think when Leanne said measuring collaboration, those kind of more abstract, harder to quantify concepts, the measurement of those, I think would that aligns with that outcomes measurement.
Thank you.
I think this is Lori. I think that sounds great because outputs are so different, but can seem so, can be borderline one or the other. And they're very, if you're working with federal funding, outcomes, there's all kinds of bolded letter in our funding opportunity announcement. If we are looking for outcomes, an outcome is not an output. And we could get a whole gaggle of people on to learn about that because it's a difficult concept because it is.
And my situation, I believe that sometimes outputs actually are outcomes. If you have targeted, we're going to increase, and I won't go into it now, but as I often say that the whole logic models and measurement is an art often more than a science. And so, sort of teasing out what are real outcomes and what are real outputs and where do they overlap. I could actually do a Venn diagram of where they actually will overlap, especially as it relates to collaboration. So
that's that's where the complexity comes because they will overlap, but how to differentiate what's outside of the combined circle.
Right.
Well, and I think we think of outcomes in terms of like systems change, long-term outcomes. And none of us are going to be around long enough to see a lot of those. So what are those measures on the in-between? What are those short and midterm outcomes that aren't outputs? You know, I'm just getting back to some of the same discussion.
And I agree with Marilyn on that. I was going to say, really looking at when we're measuring the short term and sort of like the medium, not so much the long term, but it's when you're really looking at that short term and how do you determine that one? Because it seems like there could be some confusion with that.
Well, I have a feeling that our next meeting will probably, the theme is going to be around measuring collaboration. And I am really looking forward to that. Any last minute comments before I try and figure out how to copy? Would one of the co-hosts know how to copy the chat so I don't lose it? I don't know. Okay, the chat. Sorry.
You should be
You
able
go
to
to the
get
three
it.
little dots next to the file and hit save chat.
Yeah, you should get it to save and then it'll automatically download to your computer as the
Very
host.
good then. Okay, great. That'll make it a lot easier for me.
Sandra, Marilyn had asked if I would mind sharing a copy of our resolution that formed the coalition. If that'd be helpful, I'd be glad to send it out to the group if y'all think that would be of interest.
In my emails, I copy everybody. So just go ahead and use one of those emails and send it out.
Okay.
In fact, whenever you have anything to share, we'd love, we want to build our resource library up.
Gotcha.
Cassandra, this may be a simplistic request, but being able to have a better understanding of how to take a full wealth of data and research summaries and put it into the infographic, such as what was shared by Idaho this afternoon, would be incredibly helpful at some point, whether it's woven into an existing presentation, but we put our hearts and souls into this wealth of detail or process, and how do we choose 5 or 6 main topics and make it presentable in a single one-page handout that is easily understood by those who are not familiar with the details of what went in, so that we don't minimize important information, but yet provide it in that ever so important graphic.
Wonderful. You know, it might even be worth our while because I've been working on doing 2-page evaluation briefs for states, and this is around community-based child abuse prevention, but I did one of them on respite. But it might be good to even have, if she'd be willing, and Jill might be screaming at me silently for this, but one of our graphic design people to maybe even talk about, so we can talk about content, which is one thing, but also organizing the content so that it's really understandable. You're showing the right stuff and you're showing it in a visually appealing way that makes sense. So that would be, I don't know if we could, that might be the following collaborative meeting, but I think that would be great. And thank you, Joe. He's put in discussion of common data elements for all of us to measure. Boy, I think that is so important. I bet we could probably fit that in during our next meeting, but I'm not going to lose track of that, Joe, so thank you. Okay. So I think we've actually almost made it to our time limit. If anyone else has anything to share, now's your last chance for this meeting. And I hope you'll all write each other. We've got the email with everybody's email addresses on it. Feel free to write each other, or if you have new ideas or if you have documents to share, feel free to use those boy, you might be mad at me too for filling up your inboxes, but if you have something to share, there's your opportunity. Take advantage of it. So on that note, anything else? I'm going to say goodbye. Thank you so much. I learned a great deal from this meeting. I really appreciate. Thanks to our presenters and our worthy participants. So bye-bye. I'm going to end the meeting.